Deputy Brady.
Here, look, Minister, Deputy Boyd Barrett mentioned Sarah Ann and scoliosis, and there's many other children out there suffering from scoliosis, and indeed my own daughter has scoliosis. She has a curve in her spine of 45 degrees. Now, unfortunately, my daughter, like many other children out there, it wasn't identified. It wasn't picked up until late. She was 16 when it was identified. At that stage, the option of putting a back brace on it wasn't an option because she was mature and her growth was coming to an end. There was a point, and indeed when I was a child, the public health nurse would go into all schools across the state, as they still do, to carry out vaccination. But at that time, they would check the spine. They would check for scoliosis. That process has stopped, Minister. Minister, that is a very simple process, less than 2 minutes. And that early identification of scoliosis would stop that pain children have to endure. It would, in some cases, it would stop them having to receive surgery later on. Minister, I ask you a direct question. Can you ensure that that process is rolled out to all public health nurses? It's a very simple process. We don't need an action plan for this to happen. We don't need to wait till the end of the month. This can happen in the morning. I'm asking you, Minister, can you ensure that that process is rolled out immediately?
The Minister to respond.
In relation to Deputy Brady and telling us of your own experience, which I appreciate you sharing with the House, the issue of school screening has been raised with me by a number of the advocacy groups. It is one of the issues that I've asked be looked at and considered by the Health Service in the context of the action plan. I'm not asking anyone to wait forever for an action plan. By the end of this month of February, we will have a plan to deal with scoliosis that will see waiting lists and waiting times dramatically reduced this year. It seems to me to be a logical suggestion, but I believe it was changed on a clinical basis or a clinical view. Sounds to me like there's merit in it, and it is being considered in the context of the action plan, and I will engage with the advocacy groups on that too.